Hi there, my name's Jeremy Lamb. I'm one of the providers here at Healthcare Express in Midwest City, and we want to start bringing you some weekly, not really updates, but more just some health information that you and your family can use as you kind of navigate the cold and flu season and then throughout the year, just so you can kind of become more educated and learn more about specific things that may affect you or your kiddos. We'll try to correspond these with a brief blog post that we will post to our Facebook page or Google page, or you may see on our Twitter account, and we'll try to correspond them and kind of correlate them together. Today, I want to talk real briefly to you about throat infections, or the medical term for that would be pharyngitis. This time of year, here in the middle of cold and flu season, we tend to see a lot of sore throats as the main complaint that bring people into our urgent care. And I just want to talk real quickly about that and let you know kind of what causes them, what we do about them, and why we need to treat them. So what causes throat infections or pharyngitis? It's really three things. The most common two are going to be viruses, bacteria, and then occasionally, very occasionally, in someone who's sick or elderly, you may get a fungal type throat infection. It's difficult to distinguish which is the cause or what's causing the throat infections based on the exam alone, because a lot of the symptoms are the same. So that's why it's important that we do some testing and figure things out. The symptoms that you're going to have for the most part with pharyngitis or throat infection is throat pain, of course. Usually it's accompanied by fever, maybe some lymph node swelling in your neck, and usually you have those symptoms without having a cough or congestion. Cough and congestion can be another cause of sore throat, but that's usually a result of a different infection and not just an infection of the throat alone. So other more rare but serious side effects you can see, or serious, not side effects, but serious symptoms you can see with a throat infection: fatigue, loss of appetite, headache, and then nausea and vomiting. Those are rare, but sometimes more serious. Now, why is it important to treat throat infections? Well, first we have to distinguish what's causing your throat infection. The vast majority of the time they're viral infections, which are pretty self-limiting, and you get better whether you ever come and see us or not. The main reason you would come see us for a viral throat infection is because you feel terrible. And there's lots of different things we can do to make you feel better faster. The second most common reason you have a throat infection is going to be because of a bacteria. This we usually do a culture on, or we'll do a quick test, a strep test in the clinic to make sure it's not a bacteria. And we're pretty aggressive treating those because in young kids and even adults, if you have a latent or you have a strep bacteria infection that it goes untreated, you could have other serious consequences that might affect other organs, either immediately or down the line. Fungal infections are rare, and when we do find them, we treat them very aggressively. But again, that's something you would see someone in someone who's elderly or immunocompromised or has some other serious health problems that haven't been addressed or have been neglected. A couple quick tips. One, for adults, when you have a throat infection, it will knock you on your butt. You will feel awful. You will be laid up on a couch and will feel terrible. And what's so interesting to me is that when a small child or a kid has a throat infection, you sometimes would never even know it. They're jumping around, playing, having a great time. Then you look in their throat and it looks like a bomb went off. It's just red and pus and tonsils everywhere. It just looks awful. But you wouldn't know it just from looking at them. So that's one of those things that we like to look at in the clinic and just say, oh, this kiddo's got a bad throat infection, but sometimes you'd never know it. Another little quick tip for you too on your kiddos especially is that a lot of times they don't complain of throat pain. Sometimes that's hardly ever a complaint that they have when they have an actual throat infection. They complain of headache and belly pain. And so if your kiddo starts complaining that his head hurts or that his belly doesn't feel right, bring him in, we'll test him, we'll look at it and make sure that, not only make sure his belly and head are right, but a lot of times that is indicative of a throat infection. So just a couple things for you guys to think about as you kind of go through this cold and flu season. Like I said, we're happy to get you in and look at you anytime, and hope you and your family stay warm and healthy this winter.